Hmm. Hi, Don here. Welcome to the Podiatry Management Minute. Today I want to talk about my paper schedule that I use, and I use this to do a couple of things. I've talked about it before and how I track no's. I also use this to track follow-up calls, and I also use it to track production. So each day, what I talked about yesterday was my little tracker for what level office visit I do. And this is the other thing I have. I have a piece of paper right in front of me with the patient's name, and I track things on it. And I think it's a way to keep it front of mind when I'm treating patients, to make sure I'm giving them the best care, and also I'm being the most profitable. So the way I use it, and I would consider, you may want to consider trying this, is, and I have a newer version now. Up here, I write OV, which is office visit. Right here, I write DME and imaging. Right here, I write procedures. And then right here, I write next. And so the way I use it is I put the level office visit with a circle around it, just to remind me, so I can keep my eye on trying to do the most, to code appropriately for what I'm seeing. I put here my x-rays if I'm doing x-ray or ultrasound or things like that, to remind myself to do that. DME, like I've been doing night splint, cam boot, collagen dressing, things like that. And then here I put the procedures, just to kind of keep my eyes on the prize, because the focus tends to be doing, office visits, doing procedures and things like that. And then I put a goal up top, which is usually 2 orthotics per day. And I write that up top. And so I try to keep that goal. And then as I'm doing an orthotic or an AFO, I'll put orthotic number 1, orthotic number 2. And then I can also do it to track follow-up calls. So if there's a certain patient that I want to call, let's say I do a procedure on them, or I'm concerned about them, I will highlight that with a highlighter that I have right here. And I highlight it, and it reminds me. I can either give that to my staff, and then they can call the patient and see how they're doing the next day, or I can call them just as a reminder, and I leave that on my desk. And one last thing, which I would recommend, I pick one patient of the day, which is the MVP, which I would call the most valuable patient. And I kind of so I can keep my eye on what's the most valuable thing, what are the things that are producing most revenue for the practice, so I can kind of, what you focus on tends to grow. So hope that is beneficial and helpful for you all listening. Okay, thanks.